Turning back to America's new investment in the global fight against COVID-19. President Biden is set to officially announce in England today that the U.S. plans to donate 500 million doses of the Pfizer vaccine to countries that need it most. The doses will get distributed to nearly 100 countries over the next 12 months, with the first 200 million doses going out this year. The International Vaccine Initiative, COVAX, is heavily involved in the process. Earlier on CBS This Morning, White House Press Secretary Jen Psaki stressed the importance of the U.S. effort to vaccinate the rest of the globe.
We are by far and away, the United States is the largest contributor to vaccine doses around the world, because we know that's not only the right thing to do, but it's also a smart thing to do to ensure we're keeping the American people safe. And this is just the beginning. We're going to help boost manufacturing in the United States, get more doses out. We're going to ensure countries have the know-how to produce vaccines, and we're going to help make sure countries have raw materials and medical supplies needed to help get this pandemic under control. And we're going to lead the effort from the United States.
Joining us now is Dr. Amish Adalja, who's an infectious disease expert and a senior scholar at the Johns Hopkins University Bloomberg School of Public Health. So, Doctor, the U.S. is facing pressure to improve vaccination rates in poor countries. Explain why helping other nations' vaccination efforts is so important when it comes to containing this virus. And it's frankly not the first time the United States has done that. We've led the vaccination efforts in the past when it comes to polio, for example, and smallpox before that.
You have to remember that when you have an infectious disease outbreak spilling out of control in any corner of the globe, it's going to impact the rest of the world. We will still have disrupted trade. We will have disrupted travel. We still will have new variants being generated. We will still be sort of out in the acute phase of the pandemic as a planet until this is controlled in all corners of the globe. So I think it's really important to try and go after COVID-19 wherever it's finding safe harbor in certain countries and really remove its ability to cause serious disease, hospitalizations and deaths wherever it may be occurring. And that's how we truly go into a post-pandemic world.
So providing the doses is one thing, but I imagine that support to make sure that those doses are administered is also something that some of these countries would need. What else can the Biden administration do?
You can make sure that they have the actual infrastructure to deliver the doses. We saw early on in our vaccine rollout that it was difficult to get shots into people's arms. We have to make sure that other countries can do that as well by giving them the resources. If you're using vaccines, for example, that require extreme cold storage, that they have that technology, that they actually have vaccinators, that they actually have needles and syringes, that they have the ability to transport vaccine throughout their country. So these are big undertakings, especially in resource-poor countries that don't have much infrastructure and rely on donor countries as well as the World Health Organization and other NGO-type organizations to scale up their vaccination program. So this is going to be a process that probably will take us into 2022.
Vaccine advisors for the FDA are holding a virtual meeting today to discuss rules for authorizing COVID shots for children under 12. What should the agency consider in your experience before giving the go-ahead? How much safety data will they need?
The biggest thing they need to consider is the risk-benefit ratio, and we do that with every age group that we approve a vaccine for, because when you're talking about children that are under the age of 12, they're generally spared the severe consequences of disease. They're not likely to be the magnifiers of infection in the community the way they are with influenza, so there's a different risk-benefit ratio. So they've got to look at the side effect profile in the clinical trials of the vaccines and the benefit that those children receive from the vaccine, and then make a decision on whether this age group, it makes sense to vaccinate. And I think they probably will come down on the side of, yes, this is something that they should do, but it's a deliberate process that we want to go through to make sure that we're actually making the correct decision when it comes to vaccinating children. They're going to have to look at dosing, they're going to have to look at the spacing of the vaccine, and just make sure that everything fits in that age group the way it fit in the 12 and up age group.
So, Doctor, there's new evidence suggesting Johnson & Johnson's COVID-19 vaccines remain effective against several variants by inducing a strong T-cell response. Can you just break down the medical jargon for us and tell us what exactly that means and why it's significant?
So most people, when they think about the immune system, they think about antibodies because they've all heard about antibodies. Those are easy to measure. But there's a whole other arm of the immune system called the T cell response. And those are cells. They're not antibodies. They're actual cells that can help coordinate your immune response. They can attack infected cells. And what we know is that vaccines produce not just antibodies, which everybody measures and talks about, but also really robust T-cell responses. And those T-cell responses seem to be very key when it comes to variants that might pose a little bit of a problem for our antibodies. We still have this whole other arm of the immune system that's at work. And indeed, I do think that when we look at how well the vaccines have done against the variants, especially when it comes to what matters, serious disease, hospitalization, and death, it's the T-cell response that's very, very instrumental. So this is not a surprising result. We know that the J&J vaccine is a safe and efficacious vaccine, and I suspect all the vaccines induce major T-cell responses that give us the ability to be resilient against the variants that the virus throws at us.
There is a potential COVID-19 treatment that may be on the horizon following tests of anti-aging therapy in mice. Explain what scientists are looking at here and how beneficial these anti-aging drugs could be in the fight against COVID-19. I'd like one of those.
So this is very early stage research in mice, so it's going to be some time before this actually translates into humans. But what we know is when people age, some of your cells become what are called senescent, which just kind of means they become sort of senile, or they become less functional. And when you have an infection, those cells that are senescent, the older people, the older age cells, can be very pro-inflammatory, meaning they kick off a big response in your immune system, and that can lead to the severe consequences of disease. So this hypothesis that's being tested in these trials is that if you can remove those cells, those older cells that are not really that functional but cause a lot of problems during an infection, maybe you get a better outcome. So this is something that's an interesting study. It's in mice. It's going to take some time before it translates into humans, but I do think there are synergies between other parts of medicine and COVID-19 and vice versa that we're going to kind of see come to fruition as we progress through this pandemic, as we learn more about the body's response to this virus.
You know what I hope comes out of this, not just obviously getting a handle on the pandemic, but it seems like there's so much really interesting science that's coming out of it as well that hopefully will spill into all other areas of healthcare, and we will be all the better for it, Doctor.
That's a good, that's an interesting question, Anne-Marie and Dr. Adalja. I wonder, because oftentimes when science and scientists look for ways to combating major illnesses, infections, they come across things that they say, oh, turns out that this might really work really well for something else, like in what we're talking about here. Yeah. I mean, I know it's early and we're still trying to get a grip on the pandemic, but I'm just looking ahead. Have you seen anything besides this study that looks interesting to you? Whether it's life-saving or perhaps even cosmetic?
The biggest issue is the mRNA vaccines. We've seen the Pfizer and Moderna vaccines basically catapult to the top of the line. They've been able to show how effective they are. This is going to have a cascading impact outside of COVID-19 on vaccines as a whole. We've also seen anti-inflammatory therapies, meaning like drugs that people get in the ICU when they're in a severe cytokine storm with COVID-19. That's going to change the way we treat severe cytokine storms for other infections or other conditions. So yes, there's lots of synergy. Remember, science is one big interconnected, integrated whole. So when you have a discovery in one branch of science, it's going to trickle through all other branches of science. I mean, that's how it works. And I think it is going to be exciting to see what happens after COVID-19, how much gets catalyzed in this whole field, in the whole biomedical field, because I do think we're on the dawn of a new age of vaccines, new treatments, and better understanding of viruses, better diagnostics. Lots of things are really going to move forward after this pandemic, because there's a window of opportunity to get this right so that we become better and we become more resilient as a species to all of these health threats that we face.
I bet you this is part of a pattern. I bet you we've seen this with other pandemics where there's sort of a burst of science afterwards, but that's something to talk about on another day. For now, Dr. Adalja, thank you so much for joining us.
Thanks for having me.